On every Thursday of the week, this seat beckons at those who superintend over institutions of government, be it politics, economy, personality, or even socio-religious life, to give account of stewardship of what leaders have done or doing with the resources allocated to them at all levels and spheres of life. Watch Stewardship on RSTV every Thursday at 12:30 p.m. Stewardship with SNB, a point-blank approach to TV journalism. Good afternoon, everyone, and thanks for joining us on the program Stewardship with SNB. The roving camera lens of stewardship caught up with the Commissioner for Health in Rivers State, and so we are in her office for this special edition of the program Stewardship with SNB. You can watch us on GoTV channel 142 and Star Times channel 113. You can also connect to our social media handles via the numbers or handles at RSTV22PH online, and of course on YouTube, Instagram, and X handles. All of these platforms you can connect to us and watch us live. Today I'm joined in the office of the Commissioner for Health by no other person than the Commissioner for Health in River State, Dr. Adaeze Oreh. Honorable Commissioner, welcome to our program.
Thank you very much. Thank you for having me.
First and foremost, let's congratulate you on your appointment as Commissioner for Health in River State.
Thank you very much.
All right. Generally, it is believed that the girl child is closer to a father than the mother. You are a medical doctor, and your father, the former governor of River State, is also a very respected medical doctor. Whom, between the parents, did you take after?
First of all, thank you for starting off with that question. Just a couple of days following the International Day of the Girl Child, I would like to address that question by saying I think it is more about personalities and relationships and not specifically about gender. So I have a very close relationship with my father, and I have a very close relationship with my mother as well. So I wouldn't say I'm closest to either one of them. And then, of course, after this interview, I would have to answer for anything I say to the contrary.
All right. All right, let's take you straight to the real issues on ground. Currently, what's the focus of the ministry? Is it preventive or curative medicine or medication that you're looking at?
Thank you very much for bringing that up. When we look at healthcare, healthcare occurs across a continuum. And so you have the preventive aspect where you want to promote health, promote individual health, prevent disease. And so that's the preventive aspect of health. Or for those who may have succumbed to an illness, you'll be looking at curative. And beyond curative, those who may have an illness may have complications from that illness, and then you'll be looking at rehabilitative services that would help to improve their condition and improve their quality of life. Now, the focus of the ministry draws on the focus of the administration of His Excellency Governor Siminalayi Fubara, Grand Service Star of River State, is that we improve the health outcomes of the people of River State. And what that means in essence is that in alignment with the Sustainable Development Goals for health and well-being for all, we do not want to leave anyone behind. So while we have a focus on preventive healthcare services, we are also very mindful and have a focus on curative and rehabilitative services for our people. So for those who are not ill, those who may belong to certain demographics that are prone or vulnerable to certain illnesses, preventive services will definitely come into play. Health education, health promotion, and disease prevention for such cases. But we also acknowledge that there are people who have certain burdens of illness, either infective illness or non-communicable diseases. And so for those, we want to ensure that the state is able to provide services that would lead to the healing or curative services, as you earlier referred to. And for those who may have some complications and require rehabilitation to improve their quality of life, prevent the deterioration of those complications, and improve their well-being, we will be providing rehabilitative services. So the emphasis is to not leave anyone behind and provide the gamut of care across that continuum for the people from and living in Rivers State.
All right. If you take a look at the infections in our health cycle, malaria and typhoid constitute the highest health burden of the state. What is your ministry doing to minimize the prevalence of these diseases?
So when you mention malaria and typhoid, sometimes in the healthcare spaces, we say how was the typhoid diagnosed? Because a lot of these illnesses are wrongly diagnosed. People just assume that because we're in the tropics, any illness may be put down to either malaria or typhoid, whereas the necessary things to arrive at that diagnosis may have not been done. So let me address your question by addressing what we're doing as a state to tackle infectious diseases in general. In the Rivers State Ministry of Health, we have a very robust department or directorate, which is the Directorate of Public Health and Disease Control. And so a lot of the activities aimed at preventing the burden of infectious diseases take place from that directorate and that department. And so if we look at immunization, we work very closely with the Rivers State Primary Healthcare Management Board to ensure that immunization services are provided across the state. This is not done just within the state itself. We also rely on partner engagement, which is another focus of this administration, working with the World Health Organization, working with bodies such as UNICEF and other partners to ensure that these vaccination activities take place to protect individuals from infections. Now, recently, the government, the administration, had inaugurated a flood management committee because we realize that Rivers State is one of those states that is prone and vulnerable to floods and associated hazards. And part of that, the outcomes of that committee was a flag off where we also flagged off vaccination against infectious diseases, which we know tend to increase in prevalence at certain seasons of the year. And further to that, yesterday, at one of the primary schools, Olanada Primary School in Rumola, here in Port Harcourt, we flagged off the school deworming program. I want to just show the extent of preventive initiatives to protect the health of our people from infectious conditions. And so going beyond the malaria and the typhoid you referred to, even soil-transmitted helminthiasis and worm infestations are things that we should protect our vulnerable populations, especially school-age children, from such infestations. And so that was what the flag off of the school deworming campaign was all about yesterday.
Okay.
So immunization is a key aspect of that. Drawing further, we will talk about health security. And so making sure that our health system is robust enough to actively and passively be made aware of any risk of outbreaks of various infections that could provide a threat to the lives and well-being of our people is critical to our function here in the Rivers State Ministry of Health.
Honorable Commissioner, take us through the recently approved malaria vaccines by WHO. How available are these vaccines to families?
So when
because it must pass through your ministry. Yeah.
Definitely, and that's a very, very insightful question that you have just asked. The malaria vaccine, when it first came on the market, was approved for 12 African countries, and
Nigeria inclusive.
Nigeria was not
included
in that list of 12 African countries.
Okay.
And so multiple countries on the continent, obviously not at our size, had access to the vaccine. And so the federal government made an announcement in April of this year that Nigeria was interested in having access to that vaccine that has been produced by the Oxford University in the United Kingdom. Now, we have, as a country, we have entered into conversations with Gavi, the Vaccine Alliance, to see how the vaccine can be made available to the Nigerian population.
Yeah.
And so once that is done, you can be sure that it will be available for people within the country to access.
All right. We want to know, some of the doctors that are posted in rural areas do not want to report there because of unavailability of basic infrastructure, like maybe electricity, good drinking water, and all of that. What's your monitoring mechanism like to ensure that these doctors actually report at the rural areas where they're posted to? It's important that they are there.
Yes, and I like the fact that you said it's important that they're there,
Yeah.
which brings me to a major challenge within the health sector. Currently, which is not specific to Rivers State and is not specific to even Nigeria. And that is the issue of the challenge with the health workforce. Now, you may be or you may not be familiar with the term brain drain
Brain drain.
or
Okay.
Japa syndrome.
Okay.
And this is something that is happening. It had started happening prior to even the COVID-19 pandemic. But drawing after the COVID-19 pandemic, we're seeing an exit of healthcare workers, not just in Rivers State, but across the country and across countries of a similar socioeconomic profile as Nigeria, going to Western countries, where it seems that there is a demand which increased after the COVID-19 pandemic. And so a lot of our healthcare workers are actively being fought for. So one of the focuses of this administration is to see how to build our healthcare workforce in terms of the engagement of professionals that are specialized or skilled in healthcare, so that we have a system where, as we are building, equipping, renovating our health facilities, there's adequate manpower to man such facilities. And so the engagement of healthcare workers is one aspect. Ensuring that they're adequately remunerated, compensated for the work that they do is also another aspect of motivating the health workforce, so that when they are assigned or posted to even rural facilities, then they are likely to remain there. Because as you and I know, the reason for the pull to urban locations is because of that drive for more opportunities. And it also brings me to what you mentioned about the challenge of water and essential facilities at our rural
not there.
areas, which are not there. And so when, as a government, as we're looking to, which we have even started the revitalization and refurbishment of certain facilities, key to that is an enabling environment for the healthcare workers who will be posted there, so that they can live comfortably and provide the services that they are required to in an optimal setting. And so water will be is critical to that. Other sanitary facilities, water sanitation, hygiene, which is called WASH, for the patients and for the healthcare providers who are in such facilities. So in providing a quality healthcare system at the rural area, we're not just looking at the clinical aspect, we're also looking at the environmental aspect for the healthcare workers who will be providing such services. So while we look to addressing some of these challenges, we're looking holistically at what are those factors that hinder their performance, and working to creating that enabling environment for the healthcare practitioners to provide the services that the population will need.
Okay, Honorable Commissioner, before you were appointed as Commissioner, you have been a practicing medical doctor, am I correct?
Yes.
All right, meaning that what I want to ask you will not be strange to you. Even as a Commissioner, there are some rural communities in Rivers State that have always suffered cholera every year. Communities like Bakana, Mile in Degema local government area. What is your ministry doing to forestall future occurrence of these infections?
When you refer to certain diseases like cholera, those are diseases.
It takes us back to poor water and all of that,
It's
and sanitary condition and all of that.
It boils down to the availability of water,
Yeah.
sanitation, and hygiene facilities.
Yeah.
And so it also brings me to mention the multi-pronged approach that we're using here in the Ministry of Health. We're not working in a silo. We're working together, collaboratively with other ministries, departments, and agencies that are not purely health focused. So, of course, water and the environment will be critical to that. Because for as long as people do not have access to safe water, they will always be prone to diseases like cholera. And we also know these communities you've mentioned are also severely prone to flood and related hazards. And so when those floods come, they wash away sewage material, which then comes into where people are residing, thus presenting hazards to their health. And so ensuring that even as we plan to mitigate the effects of impending floods or floods that have come, in providing temporary shelter, water, sanitation, and hygiene is also a critical part to that. And so even in the Flood Management Committee, which the Ministry of Health is represented, the Ministry of Environment is also very active there to ensure that we are working together in consonance, that those who may be victims and prone to such diseases such as cholera are protected, because we've ensured that there's adequate water sanitation facilities available to them where needed.
All right, Honorable Commissioner, we've been talking to Dr. Adaeze Oreh, the Honorable Commissioner for Health here in River State. We'll take a short break, and when we return, she will take us through what steps the ministry is doing or taking to make sure that diphtheria and cholera that we'll be talking about does not ravage rivers communities as it is in the northern part of the country. Stay with us. Welcome back. If you have just joined us, this is Stewardship with SNB from the Office of the Commissioner for Health, Dr. Adaeze Oreh.
On every Thursday of the week, this seat beckons at those who superintend over institutions of government, be it politics, economy, personality, or even social-religious life, to give account of stewardship of what leaders have done or doing with the resources allocated to them at all levels and spheres of life. Watch Stewardship on RSTV every Thursday at 12:30 p.m. Stewardship with SNB, a point-blank approach to TV journalism.
Honorable Commissioner, welcome again
Thank
to our
you.
program. All right, diphtheria, although we've talked about cholera, diphtheria and cholera is devastating the northern part of this country. There are fears that it may spread to other states such as River State and, of course, communities in the state. Are there deliberate steps by your ministry to make sure that this disease is prevented from spreading across the communities of River State?
Yes, there are very clear steps that are being taken by the ministry to prevent the upsurge and outbreaks of diphtheria and cholera that we've been hearing about across the country. And these steps it will refer to something that you mentioned early on in our conversation about prevention.
Yeah.
And so the health promotion unit in the Department of Public Health and Disease Control is at the top of disseminating information that is relevant to preventing outbreaks of this disease. And the River State Primary Healthcare Management Board as well, with the state immunization team, is actually at the forefront to ensure adequate coverage of vaccination to prevent these diseases, because both diseases you've mentioned are actually vaccine preventable diseases. And it also brings me to an effort that in the states, which is the State Immunization Task Force, which is chaired by Her Excellency, the Deputy Governor of the state, Professor Ngozi Maodu, DSSRS. We had the inaugural meeting of this administration of that task force, and it has a representation, not just players in health, meaning the River State Ministry of Health, the River State Primary Healthcare Management Board, the National Primary Healthcare Development Agency, other players who are critical stakeholders to improving and enhancing immunization coverage and primary healthcare delivery in the state are also part of that. So we have traditional rulers, we have representation of community leaders and community groups, because we realize that a major impediment to adequate vaccination coverage are some of the myths and misconceptions that prevent people from being making themselves available to be immunized, or making their children available to be immunized. And so that task force is a very holistic and comprehensive group of stakeholders across board who are working to ensure that we close the immunization gaps within the state and protect the health and well-being of our people.
Honorable Commissioner, malaria-related morbidity is higher than that of HIV morbidity. Now, but the campaign for HIV prevention is higher than that of malaria, which kills faster and which spreads more amongst the people. Why is it so? Could you educate the viewing public?
Well, when we look at the campaigns around certain diseases, a lot of times those campaigns come with funding.
Okay.
And those funding come from certain international organizations that have decided that they have a focus on HIV. And so that is why it would seem like there's a lot of attention on HIV, whereas malaria presents a very large burden of disease and has a very high mortality rate. And so it brings me to what we in the States have chosen as a focus. So while we engage with partners for certain programs, there also has to be local ownership of the disease conditions and the efforts to address disease conditions that are a major problem for our people. So while there are international organizations that have a focus on malaria as well, we will not just rest on our oars and rely solely on donor funding to ensure the health of our people. So as a state, we also have a responsibility to providing quality healthcare services based on the burden of need for our people and based on our own priorities. And so to answer your question, a lot of the campaigns you hear and comparing them to campaigns for malaria are because malaria has been in existence for a very long time. We know that it is a problem.
But HIV is not new too.
HIV is not new, but there are many organizations that have a focus for HIV for various reasons. I'm not to speak to the reasons behind certain organizations driving campaigns for certain disease conditions, but it makes me want to communicate to the public the focus of the state to drive healthcare that is based on our needs and based on our priorities, the illnesses that are a problem for our people. So even when we engage with partners, we'll make sure that our collaborations are in alignment with the needs of our people.
Honorable Commissioner, kindly confirm to us that the Rivers State University Teaching Hospital has only 2 ophthalmologists, and that this development is putting pressure on the government and even the patients themselves. Could you confirm to us that it is true? And then the second part of the question is that what have you done differently now that you're on board as a Commissioner for Health in Rivers State?
I like the thread of your questions because some of the questions are connected. And so in answering this question, I'll go back to my answer on the health workforce.
All right.
Now, ophthalmology is a specialist area. And of course, with specialist areas, they are in demand in many parts of the world or in many other states beyond Rivers State. So one of the strategies to motivate the workforce, as I mentioned before, is engaging specialists in certain areas. But it brings me to highlight one of the projects that was completed, equipped, furnished for Governor Siminalayi Fubara, GSSRS, first 100 days in office. And that was the dental, maxillofacial, ear, nose and throat,
Hospital.
and ophthalmology hospital.
Okay.
I'm emphasizing ophthalmology because of your question.
Okay. Okay.
So that is a specialist annex of the River State University Teaching Hospital. And so while I won't go into the specifics of the number of ophthalmologists, this was a clear step to improving and enhancing specialist services across dental and maxillofacial, ear, nose and throat, and specialist eye care, which is ophthalmology for the people of River State. And that is a flagship specialist center that will train specialists in these various areas and build the pool of specialists within the state that are trained and certified to provide those specialist services, thus building our specialist population and enhancing the quality of tertiary advanced level healthcare for people in River State.
Honorable Commissioner, you're aware that the people need information, and information is power. Before now, the minister used to have IEC, that's Information and Educational Communication Materials, with which you conscientize, inform the people of certain diseases that are prevalent, and ways and means of preventing them and all of that. Why did you stop?
This cessation of IEC materials is probably something prior to my assumption of office. And so I will not say it was stopped. I will say perhaps it was reduced in frequency. You know that we are also in a digital age now. And so the information and education materials are no longer solely reliant on paper-based IEC materials. And so in the ministry now, we're focusing on digitalization and communicating with the wider public, of course, through channels like yourself, the River State.
But we haven't seen much of your IEC materials.
And then we have a robust website now. We're building our social media communication channels.
Oh, I see.
So that on a daily basis, we are educating the public, informing them about relevant health days, initiatives of the Ministry of Health, and issues of public health concern that may benefit from the public being aware and protecting their health, and just generally allaying any anxieties. And so that's something that we're looking at growing within the ministry. We've started. We have a live Twitter channel for the ministry. We have one on Facebook as well. And we're pushing information to the general public to help educate while we still utilize the age-old paper-based IEC materials at our various facilities. So this is something that is dynamic and is something that we seek to grow and engage with the public. And in engaging with the public, it's not just front-facing and putting information out there. We're also utilizing the information that we get from the public about their concerns, about certain health facilities, and seeking to address some of those concerns as part of the initiatives of the ministry and of the state government.
All right, we'll draw the curtains, but just before we do that, permit me to ask you this question. 100 days of Governor Fubara in office. From the ministry's perspective, on a scale of 10, how would you want to score Governor Fubara?
On a scale of 10, I want to give him a 10 over 10, and I'll
Why?
tell you why.
Yeah.
Because healthcare, as I said, occurs in a continuum. You have primary healthcare, you have secondary healthcare, and then you have tertiary healthcare. The previous administration of Barrister Nyesom Wike, Grand Service Star, CON, did a lot of projects in tertiary healthcare and brought River State to the limelight with the conversion of the Braithwaite Memorial Specialist Hospital to the River State University Teaching Hospital, and scholarship provided to Rivers people in training in medical and allied health sciences at the Pamo University of Medical Sciences. That is enormous initiative to build the health workforce, not even for today and even into years to come. Now, in Governor Fubara's first 100 days in office, there had been renovation, refurbishment of primary healthcare centers across the 3 senatorial districts, which he announced in his broadcast to the people of River State. there was the equipping and refurbishing of the Kelsey Harrison Hospital, which is a strategically located secondary level healthcare facility in the state. And then the dental, maxillofacial, ear, nose and throat, and ophthalmology annex of the River State University Teaching Hospital. And the pathology department annex of the River State University Teaching Hospital. So in the first 100 days of His Excellency's being the Executive Governor of River State, he has executed and delivered projects across these three sectors, these three levels of healthcare delivery. That for me is a 10/10. And the reason is because his emphasis is to leave no one behind. Ensure that at the primary healthcare level, there are facilities that people can go to at their doorstep or at the grassroots. At the secondary level, there are also facilities that they can refer complicated cases that can not be managed at the primary healthcare level. And beyond that, specialist advanced level care at the tertiary level through the dental, maxillofacial, ENT and ophthalmology hospital. So for me, that is a wonderful performance in the first 100 days in office, and we can only build from that.
All right, Dr. Adaeze Oreh, the Honorable Commissioner for Health in River State, thank you so much for talking to us. We feel very honored talking to us.
Thank you very much. It's been a privilege speaking with you today.
My name is Solomon Nelson Braid. We'll see you again same time next week. We shall bring you another guest on the program. Bye-bye.
On every Thursday of the week, this seat beckons at those who superintend over institutions of government, be it politics, economy, personality, or even social-religious life, to give account of stewardship of what leaders have done or doing with the resources allocated to them at all levels and spheres of life. Watch Stewardship on RSTV every Thursday at 12:30 p.m. Stewardship with SNB, a point-blank approach to TV journalism.